Hello everyone! Today, we are going to show you how to perform a testicular self-examination. But before we get right into it, what is a testicular self-examination? According to Mayo Clinic, a testicular self-exam is an inspection of the appearance and feel of your testicles. You can do a testicular exam yourself, typically standing in front of a mirror. Routine testicular self-exams can give you a greater awareness of the condition of your testicles and help you detect changes. Without further ado, this is how you perform a testicular self-examination. During a shower or bath is the easiest time to examine the testes. Use both hands to feel each testis. Roll the testis between the thumb and first 3 fingers until the entire surface has been covered, and palpate each one separately. Identify the structures. The testis should feel round and smooth, like a hard-boiled egg. Differentiate the testis from the epididymis. The epididymis is not as smooth as the egg-shaped testis. One testis may be larger than the other. Size is not as important as texture. Check for lumps, irregularities, pain in the testes, or a dragging sensation. Locate the spermatic cord, which is usually firm and smooth and goes up toward the groin. Choose a consistent day of the month, preferably one that is easy to remember, such as a birth date, on which to examine the testes. The examination can be performed more frequently if desired. Notify the healthcare provider at once if any abnormalities are found. And that's how you perform a testicular self-examination. Remember, changes in your testicles could be a sign of a common benign condition such as an infection or a cyst, or a less common condition such as testicular cancer. That is why it is important for you to have those testicles regularly checked. Thanks for watching.
Good afternoon, everyone. Today we are going to perform regarding testicular self-examination. Before performing this procedure, I'd like to add a few insights regarding this. First, what you need to understand is that anyone can perform this procedure regardless of whether or not they have a medical profession. 2, this procedure should be performed easiest at the time during the shower or the bath. So in performing this procedure, first what you need to do is to feel both hands with the testis. Roll the testis between the thumb and the first 3 fingers until the entire surface has been covered, like so. You palpate each of them separately. You identify the structures. So the testis should feel like a round, smooth, like a hard-boiled egg. You differentiate the testis from the epididymis. So the epididymis is not as smooth as the egg-shaped testis. One testis may be larger than the other. So this is one of the important things you need to note. So size is not important, but the texture. You need to check for lumps, irregularities, pain in the testis, or a dragging sensation. Locate the spermatic cord, which is usually a firm and smooth cord that goes up to the groin. So it is usually where your sperms mature. So choose a consistent day of the month, since this procedure is performed at least once a month, such as a birth date or an anniversary. So the examination should be performed as frequently as desired, and that it should be notified to the physician whenever there are irregularities that are found.
flat with a folded towel or pillow under the left shoulder to check the left breast with the right hand. Lying flat with a folded towel or pillows under the shoulders during a breast examination is a technique that can help to spread the breast tissue more evenly, making it easier to examine for lumps or changes. It allows for better access and visibility during a self-breast exam or a clinical breast examination. This position helps ensure that the breast tissue is not bunched up, which could potentially hide small abnormalities.
Arms behind the head, clasp hands and press his hands forward, mouth slightly forward, and note any changes in the contour of shape of your breast. Any irregularities.
This position allows better access to the lymph nodes and breast tissue in the underarm area. Second, using 3 fingers distributes pressure more evenly across the breast tissue. Lastly, the circular motion helps to feel for any abnormalities or lumps that could potentially be signs of breast cancer or other health issues.
While applying pressure until begins palpating the left breast by moving finger pads of the right hand starting at the outer edge of the breast in small circle while applying pressure until reaching the nipple. Squeeze the nipple gently, palpates the entire breast area. This procedure describes a clinical breast examination which is performed to check for lumps or abnormalities, as early detection of breast cancer can lead to better treatment outcomes.
During a shower or bath is the easiest time to examine the testis. Rationale. The scrotum, or the skin covering of the testicles, is at its most relaxed. Therefore, it is simpler to feel the testicles for any bumps or lumps.
Use both hands to feel each testis. Gently roll the testicle between your thumbs and fingers. Look for any changes to the testicle. Check for any hand lumps, smooth rounded lumps, or new changes in the size, shape, or consistency of the testicle.
Identify the structures. The testis should feel round and smooth like a hard-boiled egg. Differentiate the testis from the epididymis. The epididymis is not as smooth as the egg-shaped testis. One testis may be larger than the other. Size is not as important as its texture.
Check for lumps, irregularities, pain in the testis, or a jogging sensation. Locate the spermatic cord, which is usually firm and smooth and goes up toward the groin. Check out for lumps, irregularities, pain, or a jogging sensation in the testes is important because these can be signs of potential health issues, including testicular cancer or other conditions. The spermatic cord examination helps detect abnormalities or changes in this area. which is vital for reproductive and overall health. Regular self-examinations can aid in early detection and treatment if there are any concerns.
It is best to consult with a healthcare professional to evaluate your specific situation and guide you through any necessary further examination or treatment.